Imagine going to a doctor for help. You trust this person to care for you. Now imagine that doctor tells you your ability to love is a sickness. They say your feelings for another person are wrong. They call it a mental illness that must be cured. For many decades, this was not a bad dream. It was the reality for gay people, lesbian people, bisexual people. Doctors, sworn to do no harm, used their authority to label love as a disease. This decision caused immense suffering. It broke families, destroyed careers, ended lives. This history is not just a sad story from the past. It is a vital lesson for today. In the late 19th and early 20th centuries, the field of psychiatry was growing. Doctors wanted to understand and categorize all human behaviors. They began to look at people attracted to others of the same sex and labeled it a problem. They called it a sexual inversion, a perversion, a sick mind, a developmental defect, a moral failing. Pathologization means taking something normal and labeling it a disease. It gave prejudice a scientific-sounding name. It suggested gay people were not just different, but broken and in need of a cure. The idea spread through medical schools, textbooks, hospitals, becoming accepted truth. Being gay was framed as a public health concern, a documented disorder. Once defined as disease, the next step was a cure. This is where the real harm began. With homosexuality defined as an illness, doctors began creating cures, conversion therapies. One of the most common methods was aversion therapy. A person was shown romantic same-sex imagery, while receiving electric shocks or drugs inducing intense nausea. The idea was to train the brain to associate love with pain. These therapies did not cure anyone. They created trauma, shame, and self-loathing. Some were humiliated before groups, forced into degrading role plays. Consent was often coerced by family, court, or despair. This was mainstream. Doctors published, taught, and scaled these harms. It was a profound betrayal of the medical promise to first do no harm. Beyond psychological torture, doctors turned to biological interventions, chemicals and hormones, to change orientation. Crude theories blamed hormones. Treatments were ineffective and dangerous. Attraction did not change. Side effects mounted. The most famous victim was Alan Turing, a father of modern computing, vital to the Allied victory. In 1952, he was arrested for loving another man. Offered prison or treatment, he chose estrogen injections, chemical castration. The effects were devastating: physical changes, profound humiliation. In 1954, Alan Turing died by suicide. A brilliant mind punished, his love chemically extinguished. His story shows how medical pathologization destroyed lives. When psychological and chemical treatments failed, some doctors turned to brain surgery, the lobotomy. They severed connections in the prefrontal cortex to calm patients, some targeting homosexuality. Neurologist Walter Freeman popularized it, performing thousands. An ice pick inserted by the eye, tissue destroyed, irreversible. A lobotomy did not change orientation, it destroyed personality. People were left apathetic, childlike, creativity, intellect, independence lost. The cure was far worse than the supposed disease. It was medical violence to enforce a social norm. As harms became undeniable and new drugs arrived, lobotomy fell out of favor. A chilling reminder: a flawed diagnosis can lead to irreversible physical harm in the name of medicine. For many gay people, a diagnosis meant being locked away. Commitment could happen on a family member's word. Inside, rights vanished. You were a patient. Your identity, the symptom. Life was a nightmare of conversion therapy, electroshock, and medication. Solitary for minor infractions, or for being yourself. Shame rituals tried to crush identity. Many learned to pretend to be cured to get out. On release, jobs gone, homes lost, savings drained, and often, families too. Institutions hid difference from public view and warned others to hide or be next. Those walls held prisoners of prejudice. The memories still haunt the community. Pathologization was global, shaped by local politics and culture. In the U.S., psychoanalysis and DSM frameworks birthed conversion therapies. In the UK, law and medicine intertwined, punishment or treatment. Under Nazism, men were deported, marked with the pink triangle, abused and murdered. In the USSR, homosexuality was a state crime. Gulags and punitive psychiatry followed. Everywhere, medicine's authority justified persecution. Whether mind, body, cell, or syringe, the result was suffering. A legacy of pain crossed borders and must be remembered. The consensus seemed unbreakable until science and activists pushed back. Kinsey showed sexuality as a spectrum. Experiences were common. Hooker found no psychological difference between gay and straight men. By the late 60s, liberation movements targeted the APA. Frank Kameny declared, "Psychiatry is the enemy incarnate, a relentless war of extermination against us." Dr. John E. Fryer spoke masked as Dr. H. Anonymous, risking his career to tell the truth. The APA could no longer ignore the evidence, or the people. On December 15, 1973, the board voted to remove it from the DSM. The WHO followed in 1992. Science plus activism worked. It was a turning point. Depathologization was historic, but damage remained. Decades of labeling left deep scars on people and community. Conversion and institutional survivors carry complex trauma, anxiety, depression, mistrust of care. Fear passed to children. Be careful. Hide to stay safe. A legacy of silence and shame. During the HIV/AIDS crisis, mistrust delayed care and fueled conspiracy theories. Even now, many report judgment or misunderstanding in healthcare. The sickness label's cultural echo persists in prejudice and stigma. The cures were discredited, but their language poisoned the well. Changing a textbook line is fast. Undoing cultural harm takes generations. We still feel those effects. This history offers urgent lessons. First, remembrance. Alan Turing and the countless unnamed. Keep their stories alive. Let their suffering not be forgotten. Years, careers, health, and lives were taken. So be alert to other forms of pathologization. Question who defines normal. Let us affirm that the true duty of science and medicine is to heal, not to destroy the lives of innocent people.